Do you know what meningitis is? It's a term that might sound familiar, but its intricacies and implications may not be as well known. Well, buckle up because today we're diving deep into the world of meningitis, a world that exists at the intersection of microbiology and human health. Meningitis, in simple terms, is an inflammation of the protective membranes covering the brain and spinal cord, known collectively as the meninges. This inflammation usually occurs due to an infection, most commonly caused by viruses, but it can also be caused by bacteria, fungi, or parasites. In rare cases, non-infectious causes like certain drugs, illnesses, or even tumors can lead to meningitis. Now, you may wonder, how does this inflammation affect the body? The answer lies in the role of the meninges themselves. These membranes act as a protective shield, safeguarding our brain and spinal cord. When these membranes become inflamed, it can disrupt this protection, potentially leading to severe neurological issues, and in some cases, even death. So, what are the telltale signs of meningitis? Symptoms can include sudden high fever, severe headache, stiff neck, vomiting, sensitivity to light, and confusion. In babies, the symptoms can be even more subtle, including irritability, feeding difficulties, or an unusual bulge on the head. These symptoms can escalate quickly, so prompt medical attention is crucial. Now, you might ask, how does one diagnose meningitis? Detection typically involves a series of tests, beginning with a physical examination to check signs of infection around the head, ears, throat, and the skin along the spine. This can be followed by blood tests or a lumbar puncture, also known as a spinal tap, where a sample of fluid is taken from around the spinal cord for testing. Treatment of meningitis depends on its cause. Viral meningitis, the most common form, often resolves on its own within a couple of weeks. Rest, fluids, and over-the-counter pain medications can help ease the symptoms. However, bacterial meningitis is a medical emergency requiring immediate antibiotic treatment. In some cases, corticosteroids may be used to reduce inflammation. Fungal meningitis is treated with long-term antifungal medications. To summarize, meningitis is an inflammation of the protective membranes of the brain and spinal cord, usually due to an infection. Symptoms can range from fever and severe headache to confusion and sensitivity to light. Diagnosis involves physical examinations and tests, including blood tests and possibly a lumbar puncture. Treatment varies based on the cause, but it could include rest and fluids, antibiotics, or antifungal medications. Remember, meningitis can be serious and escalate quickly. Therefore, understanding the signs, knowing how it's diagnosed, and being aware of the potential treatments is crucial. Remaining vigilant and seeking immediate medical attention if meningitis is suspected can make all the difference. After all, knowledge is the first step to prevention.